think probably in many cases in academia and in the secular public mind too, their impressions of Christian organizations, their faith-based organizations, are based on sort of the really bad, high-profile, bad examples that are entertaining to read about and deplore, but aren't really based on the kind of work that CCIH members are doing. I want to ask one other question and welcome quick responses, and then we'll open it up to everyone. The theme of our conference has at the very end of it, in a changing world. But I don't think very much of our program really focuses very much on the changing world concept. That did come from the Global Health Council theme, and I think part of what the Global Health Council was focusing on, and I think is going to be one heavy emphasis in next week's conference in Washington, is the growing awareness of the challenge of non-communicable diseases. Because the global health field tended to focus on infectious diseases, and it's becoming obvious that even though these non-communicable chronic diseases were there all the time, the international health field didn't focus very much on them. And also part of it is that we've made so much progress in many countries in reducing and controlling infectious diseases that the remaining burden of disease tends to be much more on the chronic non-communicable diseases. So in a sense, the growing focus and concern on non-communicable diseases is really evidence of progress in global health in reducing the problem of infectious diseases to a much lower level. But in our own conference here, especially since we're celebrating 25th conference, 24 years, and we have almost 2 decades of CCIH leadership here, do you have any thoughts about the changing world for us? We focused on the Christian foundation as being as unchanging, but the world is changing, and I suppose we need to change too. So what are your thoughts or reflections on CCIH, particularly, but more widely, the Christian international health enterprise as the world changes?
As you were talking, I started thinking about, from Global Health Council's perspective, they're looking at this from a disease perspective, from infectious to chronic. And I think as Christians and within CCIH, we need to look at another issue that's, I think, increasingly problematic because of our changing world, with all the technology we have, with all the rapidness of the communication, with the social media, for example. I think there's the danger that there's much less real human relationship going on. And so I think, tying back to our relationship to God and to Christ, to be in fellowship with each other, but look at that holistically from the health implications of that, because I think there's greater migration, for example, within countries and between countries, where families are split up. Some live in the rural areas, others move to the city for jobs. So I think the whole idea of relationship and those issues of direct human contact and face-to-face love and compassion and literally hugging and touching each other, I do believe that there's some major health issues from a holistic perspective that are being challenged because of that. Kids talk, they text to each other now, but how much do they really sit around a table and talk with each other?
I would really love to defer my response to this question to some of this group, because I think you have such amazing perspectives. Would anyone like to respond on my behalf?
There were two basic issues that came up on the floor, as I understood. One was on the evidence-based practices and the faith-based organizations, and the compromises that we make in terms of quality of service that we render, if I may sort of put it together in one word. And the second issue that I heard was related to the responses that the faith-based organizations make to the changing scenario, the burden of the disease changing, funding changing, and other things as you mentioned in your theme. Let me first take the first one I'm mentioning. I would make one or two observations. It is true that many of the faith-based organizations do compromise on quality for many reasons. One could be resource, about which you will be discussing a little later. But the other one is, there are many occasions in which the faith-based organizations do make a compromise because of the compassion that is burning in their hearts. I don't know how many of you have read the various books written by Dr. Paul Brand, because I have worked with him and I have been mentored by him. I can't help but quote him. In one of his books, he mentions about this interesting phenomenon. He goes to visit his mom, who's living up the hill. Travel time is about 4 hours on the horseback. He goes there, a lady is dying, and he knows that he has to give her a drip. If he has to travel all the way back, 6 hours is lost and the lady is lost. What he does? He takes coconut water straight from the tree, drips it. Is it evidence-based? But the lady survives. So there may be occasions, and he talks about it like, even on many occasions he says, under a tamarind tree, he has done some surgeries and surgical procedures which he would normally not attempt. But if he felt that deep burning in his heart, that this is what will this person, and he is moved out of compassion to do it, it has worked. And he quotes many instances. I mean, Dr. Paul Brand, as he is a very good communicator, and he conveys it very beautifully in some of his books. So I would, I haven't been able to answer, maybe I've raised the question a little more, that as faith-based organizations, we are toying with this idea, with this question, fundamental issue. Are we really doing our work based on evidences? I may not do quite a lot of what I do if I only go by management principles. But I go beyond that and do certain things which may be questionable at times, but it does happen, and that's faith-based organization.
My name is Dan Martin. I'm now working with CDC. I have a background of being a geek as well as a public health person. And I think it's the geek side of me that rises up when I hear the statement about the changing world, because everybody always likes to talk about the changes that are happening because of our communication, because of our social networking, because of the internet itself. And God knows these changes are real. I have relationships with people I've never met around the world, around the country, in ways and in depth that I never could have had before. But I think, Laura, you alluded to something earlier when you talked about the unchanging Christianness of what we do that I think maybe is the real key. Because I think what has changed in reality is not the world, is not the needs, is not even the approaches, but merely the toolbox we use. Because even in the shift from infectious disease to chronic disease, you still have people who, due to their circumstances, due to many things way outside their control, it's politics, it's economics, it's whatever, are suffering a less than full physical and often spiritual life. The fact that it happens to be cancer instead of malaria doesn't really change the fact that the poverty and the deprivation that they have has led to their suffering. The fact that we now have internet, that we now have some new medical technologies doesn't really change the fact that we're responding in compassion, as several of you already alluded, to that suffering on a community basis as well as on an individual basis. So I think I would encourage us to think about the ways in which, despite the change we see around us, we're really dealing with a fundamentally similar world.
It's been my experience that my generation is particularly negative when it comes to faith-based organizations. I'm sure this is varied for many people. There's quite a lot of evidence that's come out talking about how our generation, experiential truth, what they experience in life, is what they hold to be the highest, most believable, etc. And I think that as a whole, we're failing to actually promote the good things that we do through media. Everyone has an iPhone, and that's really an issue. We need videotapes and things in real time, because otherwise there's nothing out there to refute all the, exaggeration of media and other sectors. So I think that really should be something discussed, and I'd love to hear what you think about that as well. Thank you.
Our mission at CCIH is to promote to promote our members better, to promote the great work that is going on in the field by our Christian members to a larger audience, and to support them either internally or externally in their efforts to have more evidence, to have more of the meat that whomever the experience, those who want to have more evidence are seeking. So I think that need is something that CCIH really wants to meet.
I celebrate, and it's not my doings at all. I just this morning learned how in texting to do numbers, which shows how far behind the curve. I was trying to get a message to Bob Lease that I won't get to the Shady Grove metro station until 9:30, and he wanted to pick me up at 9. And I didn't know how to do numbers. I hardly know how to text. I can text, but fortunately, the young person sitting beside me on the metro had some idea how to get a number out of this crazy gadget. But in the last year now, instead of CCIH being me and Sharon, who are both, is Sharon here? She's not, I'll say Neanderthals. We have Sophie, and we have Mona, and we have Davina and Nancy, and we made a bit of progress in that area as CCIH, but this is a challenge not just for CCIH as an organization, for our whole Christian international health enterprise. So your point is well taken.